one of you speakers is, and what is psychoeducation?
So education is speaking out, or speaking out about the psychology.
Okay.
Speaking out to other people.
Okay. So you are speaking to the people. Okay. Anything else? Psychoeducation?
Like the knowledge that
It's content oriented.
the knowledge that we provide to people related to the knowledge, the education that we provide to our clients that related to the psychological things.
Yes, sharing knowledge, giving knowledge, or teaching knowledge is education. Okay, so knowledge sharing, skill sharing, teaching skills, all these are education. So then what is psychoeducation? Is it an education given to people with psychiatric problem? Why do we call it psychoeducation? Hello?
That we provide will be related to the psychology or mental health?
Yes. Any sorts of education that related to psychology, mental health, etc. And probably that is something that affects the mind or psyche. And a sort of education that related to something, mind or psyche of the person, or that deals with some mental or psychiatric issues or connected or related topics. Why we should give psychoeducation to the people?
I think providing psychoeducation to patients, maybe to cope, for them to cope with their illness, or like treatment adherence. For that, I think.
Yeah, it gives them awareness. Yeah. The education specifically we give to the clients with regard to addiction treatment. What is education that we are doing? Psychoeducation, but what the topic? Specific topic. Can anyone say?
I think it will be related with substance use disorder and associated mental disorders, and about problem solving.
Very good, sir. Very good, sir. Very good. 3 things you said. You said 3 things.
Yes.
Something related to substance use disorders, then mental issues, and then so I put the 2 things as part of the education, and the third part, that is problem solving, as a skill learning. Information, that is education. Teaching skills, that is skill learning. What are the skills specifically a client, a substance using person should learn during the treatment and even during the follow-up? What are the specific skills? You can speak, please. What are
Reasoning.
skills? Reasoning, okay.
Reasoning skill and critical thinking skill.
Okay. Uh, let me tell you the life skills. Now, what is life skills? What WHO speaks about? You know, life skills like skill, assertive skills, negotiations, critical thinking skills. There are 10 of them. All these things we can teach our clients, which is connected to drug use and abstinence. So that we should not just teach what is communication, but we have to teach them what is specific about communication in substance use disorders treatment. In other words, we should teach them how to make effective communication with regard to saying no to drugs and peers, etc. So it's like you give education in the form of information and facts. You also give education that is skill learning. You teach them certain skills through certain skill learning methods. So all these comes under psycho education actually. So now we are going to have a discussion. Sorry, we will see what is psycho education. Then we will go and discuss. Psycho education means educating the clients about substance use and related problems and consequences. You rightly already said certain. So this has to be taught in a group structured specific content through using certain techniques like video tapes, audio cassette, lectures. So many methods you can use to teach the clients substance use disorders and related behaviors and consequences. So that is what is called psycho education. Now, let us have a discussion. The group that is Thai group, Myanmar group. We are two groups. Myanmar group will discuss which are groups, education group we should have, like family group, client group. Just between your what are the groups that we should have when we teach them or when we educate them. My group may discuss what are the topics for education and what are the topics for skill learning. Just mention only the topics, skill learning as well as education. Our group will tell us what are the groups, and when we finish the discussion, they present it, because the whole psychoeducation module is all about that. We can easily just skip to the slides once you have your group discussion. So group discussion is better because it is already late afternoon. Keep you alive and active. I always feel group discussion will do that. So let us break into two rooms, and then how much time do you require? 10 minutes enough now? It's very simple. Is 10 minutes?
Instruction.
Not clear.
About instruction.
Okay. Okay, let me tell you. Group, no? Who said not clear?
Hello, Chan. It's not clear about question discussed. Can you tell again?
Okay, I want what are the topics education? What are the topics? Yeah. In other words, what is, on what topics you teach them during the treatment? Did you get it? Topics for psychoeducation?
Okay. Okay, Chan.
No, don't worry. In a facility, you take education sessions for the educative sessions for your. Hello, can't hear you.
Pardon me, could you please speak again?
Do you take educative for your clients?
Schedule educate.
Yeah,
Not really.
not scheduled. Do you teach? Do you teach them during the treatment? Do you teach your clients? Get
Yeah, we got that.
still confused? Pardon?
I think we clear for this one for the first, like what we teach during our treatment for the client, right?
Yeah. Yeah.
And I think for
Tell
the
me one or two topics. Yeah.
and what about the second topic, like the life skill, the skills that we also them with the psychoeducation topic, right?
Yeah. Skill means
Okay.
do you teach them problem solving skills?
Okay.
Problem
We'll have to
solving
discuss
skills?
that. Yeah, we got that now.
Yeah. Assertive skills?
Mm-hmm.
You check what are the skills. In WHO says all the skills which are very important are skill learning. You are teaching how to do.
Mm-hmm.
Teaching and skill learning are different. Teaching is information providing. Skill learning is teaching what to do and how to do. Like you stitching, you teach cooking. Likewise, you can teach how to solve problems. You get it now?
Yes.
Yeah. Okay, fine. What about the Myanmar group, Arka and Tin? What I meant? Hello.
I think your assignment is what are the types of the psychoeducation? Am I correct?
Yes, types of psychoeducation groups. Whom do you provide psychoeducation? Patients, to their families, etc. So you make the groups. Which groups? Whom do you want to give psychoeducation? Do you provide information to the family? Do you take classes for the family? Hello? Hello?
Hello.
Do you teach the family members about substance use disorders?
Yes.
Group.
Yes, we were.
Yeah, that is a group.
Yes.
So I am requesting you to, what are the groups for psychoeducation? Just tell what are the groups. Is it clear?
I think you are asking about a client with substance use disorder group, family member groups. You mean that?
Yeah, asking. Just tell us what are the groups to whom you are providing psycho education. That's all. Is it clear now?
Yes, for me.
You are still confused? Are you still confused? Ah,
No.
hello, tell me.
No, I'm not.
Are you still confused?
No, I'm not. I'm clear now.
Okay. So do you want the breakout session?
Yeah, just break for 5 minutes. Just break for 5 minutes.
Okay.
In that 5 minutes,
Okay.
just come up. Yeah.
Yes.
Good.
So we'll do the breakout sessions for 5 minutes. Thai group and Myanmar group, right? So Thai group, please join group 1, and we will join group 2. Thank you.
Thank you.
Good afternoon, Dr. Francis. I'm back. Hello, Dr. Francis. I'm back. Okay. Yeah, good afternoon.
Hello, good afternoon. I'm sorry, Nada, I leave few days, so I'm back.
It is okay, Ajahn. Me too. Afternoon. P. Panida took over Modi because I had issue with university. So thank you so much, P. Panida.
Good afternoon, Professor Francis, Dr. Francis. I'm back.
Dr. Parpan, thank you for. Yeah, hi. Okay.
I'm sorry.
Oh, very good.
Right now I cannot open camera or turn on camera because I am driving back. However, I will join
Okay,
camera.
Okay. Be careful driving. Okay. Take care. Yeah.
Sure.
Okay.
Thank you so much. I'm listening. All right.
Okay, thank you. Subhak, if you want to continue the discussion in your language, you may take 2-3 minutes. It's fine.
Okay, thank you. Yeah, okay, thank you.
Yeah, go ahead.
Okay, ห้องใหญ่ค่ะ Are you gonna listen Thai too? Okay, sorry, we'll probably talk in Thai.
Now you can talk your language, Thai language.
Okay.
Yeah.
Yes, Ajahn J. Supapak, you can discuss among Thai language. So it is opportunity that check understanding of all the Thai. Thank you, please.
ค่ะโอเคค่ะห้องใหญ่ที่psycho education ที่ได้ให้กันพอจะมีเรื่องอะไรบ้างไหมคะท็อปิกอะค่ะสอนเรื่องอะไรกันบ้างคะที่ในคลินิก
ตอบเลยตอบภาษาไทยเราทำอะไรบ้าง psycho education
ก็ให้เกี่ยวโทษพิษภัยยาเสพติดเนี่ยครับแล้วก็เกี่ยวข้องกับสุขศึกษาของเด็กที่เข้ารับการฟื้นฟูครับอาจารย์รวมถึงให้ความรู้ครอบครัวด้วยครับ
ให้ความรู้ครอบครัวให้ศึกษาเด็กที่เราเข้ารับการฟื้นฟูแล้วก็พิษภัยยาเสพติดแล้ว
จริงๆเราทำมากกว่านั้นแต่ว่า
ให้น้องตอบไปยกตัวอย่างอย่างอื่นไหมหัวข้อที่เราสอนนะ
ยกตัวอย่างเลย
การปฏิเสธสกิลอะไรนะ
ยกตัวอย่างให้อาจารย์สุภาพักฟังเพราะว่าเดี๋ยวเราจะมีการ brief a little bit ให้กับทางเมียนมาดูด้วยว่าเรา for example เนี่ยเราทำอะไรเอาเลยนุ้ย
ค่ะคือเวลาเราทำeducation กับคนไข้อะค่ะเราก็จะให้ตั้งแต่เริ่มต้นในเรื่องของโทษพิษภัยยาเสพติดให้เขาทราบในเรื่องของโทษพิษภัยแล้วก็อาจจะให้เขามีความรู้ในเรื่องของการจัดการกับอารมณ์การทักษะการปฏิเสธนะคะอะไรอีกเรื่องมีครอบครัวมี family การป้องกันการกลับไปเสพซ้ำเนาะนึกไม่ออก
ฟื้นฟูสู่โรคใหม่
ผู้สัมพันธภาพทางด้านสังคมคือให้กลับไปเข้ากับสังคมอยู่กับครอบครัวได้เข้ากับสังคมได้อะค่ะโดยประมาณนี้มันเป็นเรื่องของเหมือนทักษะการป้องกันการกลับไปเสพซ้ำค่ะประมาณนี้ค่ะถ้าเป็น education
ป้องกัน
เราช่วงที่เราทำว่าฝึกเราอย่างเงี้ยพวกไลฟ์ทั้งหลายทักษะการปฏิเสธการอะไรเงี้ยเราก็คือมีวิธีการจะให้รู้อะไรทำ
ส่วนใหญ่จะให้ความรู้เนาะส่วนใหญ่จะเป็นการให้ความรู้แล้วก็เหมือนกับให้เขาเหมือนทดลองเหมือนเขาเรียกอะไรนะฝึกว่าถ้าเกิดเจอสถานการณ์แบบนี้เขาสามารถที่จะปฏิเสธได้ไหมหรือว่าสามารถที่จะจัดการกับอารมณ์ของตัวเองได้ไหมอะค่ะอาจารย์
แล้วเราโรลเพลย์ไหม
ให้เขาฝึกอาจจะไม่ถึงโรลเพลย์อะค่ะแต่เหมือนคุยกันในประเด็นนี้ว่าจะมีวิธีการจัดการยังไงถ้าเกิดเจอสถานการณ์แบบนี้แต่ไม่ได้ให้เขาทดลองว่าจะต้องไปลองปฏิเสธเพื่อนมีเพื่อนมาอะไรอย่างเงี้ยไม่ได้ถึงกับขั้นโรลเพลย์แต่เพียงแต่เหมือนยกสถานการณ์ขึ้นมาแล้วให้เขาดูวิธีการจัดการวิธีการตัดสินใจของเขาอะค่ะ
อย่างสถานการณ์ให้แล้วก็ดูว่าเขาจะทำยังไงอย่างนี้ใช่ไหมคะ
ใช่ค่ะ เขาก็จะตอบเราเหมือนก็ตอบในกลุ่มก็อาจจะช่วยกันดิสคัสว่าเขาทำวิธีนี้นะอีกคนนึงทำวิธีนี้นะแล้วได้ผลอะไรอย่างเงี้ยค่ะประมาณนี้ค่ะอาจารย์
Okay.
ตอนนี้เท่าที่คุย
Okay, friends.
education เราบอกว่ามันเป็น
Okay. Because
ผมหมายมันเป็นเรื่อง
Okay, I really love that you discuss in your own language, but we have restrictions because
Yes.
our Myanmar friends are there and me is here, so we may not understand anything. Now it is your chance to tell us what you discussed about the topics. Just tell us what are the topics to be included in psycho education for the clients and the families. Just brief it.
Okay.
Yeah.
Topic several like how to we teach about the addiction would be like and the consequence of addictions and we rehab for the children adolescents who come for the rehabilitation. We give them the knowledge and อีกอันนะลืม sorry I forgot and for the life skills that we train like for example denial and then we do in a group and then so like we give them scenario like and then ask them how would you do in this situation like that for the skill that we train them.
Okay. So I wonder, I would like to share you more. The topics mean which are the subjects you teach them. See, we saw psychoeducation means teaching or providing information related to substance use disorders, related mental health,
Yes.
physical health, etc. So first you teach about addiction. Example,
yes. The substance use.
brain, yeah, is the brain disorder, the disease aspect, the pharmacology, the science of addiction, all those things you can teach. Those must be topics. Like consequences of physical organs, I mean medical complications. You can teach on psychiatric complications like depression, anxiety, mania, bipolar. These are topics for teaching them. You can teach them also about other related topics, financial management, spouses relationship, values in life, codependency. Likewise, there are a number of topics, maybe 20 to 30 topics are there. You choose what is right for that particular group. All this depends on which group you are teaching. Example, if you are teaching the adult male, some of the topics are common, like disease aspects, consequences, they are common. If you are teaching an adult group and women are the clients, you may have to give more importance to family life apart from the common topics like disease aspect and consequences, etc. Other topics will be about family also, about parenting, about motherhood, about managing their own issues that are related specific, like menopause, menstruation, those things. If it comes to, of course, again, it's like a disease aspect, related aspects remain the same, but you can include some other topics which are related adolescence. Now, to skill learning, the life skills. Skill learning, you are not only information, but you are teaching how to do it. As you teach them how to do it through certain role plays. Example, assertive skills. You can have a role play showing them how to say no.
Mm.
Okay?
Well, like we didn't do role play. Okay.
Yeah, not you mean the clients can do role. You can teach them certain role play. You can demonstrate how to say no. Example, yeah, an youngster, a famous market, he's tea. Suddenly he sees his close friend who is using marijuana or cocaine, and then his friend asking him to join for a puff or taking drugs. Then how he say no to his friend? That is teaching skills, skills of assertive skills. Then you can teach sobriety techniques, how to remain sober. All these skills you can teach them. There are many skills that you can teach them. But psychoeducation is you are giving information about various topics. So all these topics are part of the psychoeducation. So the difference is teaching and skill learning. Teaching is providing information only, didactic. A speaker is, there are so many learners, group learners. Whereas skill learning, the speaker teaches how to do it. That's the difference. That's all. Okay, did you get me? Now we will see the slides. Then it will be more clear to you. Is it okay?
Yes, thank you.
Now let's.
Sorry, Dr.
Yeah.
Francis. I think one important thing is it is not generalized of the topic when we teaching when we use the psychological education. But one important thing is it's up to the client. If the client are adult, we should select the education approach for adult, or if the client are youth, so we should select import approach for different group. It may be effective than we use the similar approach. Thank you.
Yes, you are right. We have to tailor or plan psychoeducation which are appropriate to specific groups. For example, if you are giving psychoeducation to family of using people, the topics differs. We discuss about codependency, recovery plans, recovery methods, follow-up methods, handling the family issues. All these things we teach in psychoeducation to the family. That's right. Now let us come to the Myanmar group, what they discussed about different groups. Let us hear from them. Arkar or Tien, who is going to speak?
I will. I will present my colleagues about what we have discussed regarding the categorization of psychoeducation group. As for Myanmar team, from the beginning, we would like to categorize the psychoeducation groups based on the substance abuse, like alcohol, stimulants, or opioids. And we would like to do is psychoeducation to individual clients, and also to I would like to provide psychoeducation to a group of clients, and also to family of the clients, which the family means adult member of the family or adolescents. And also we would like to provide psychoeducation to a group which contains both clients and family members.
Very good, Arka.
And also,
actually, I want from you.
And also,
very good. Yeah.
And also from a public health point of view, we would like to provide psychoeducation in a community, and from
Yes.
so as to prevent the substance abuse in the community, and that would include the training of trainers, and it would also include refresher training courses and working groups, etc.
Okay. You are absolutely right. A little bit different is like training of trainers actually is not part of the psychoeducation. That is more or less giving training as such. It is training and education differ actually. Now we are conducting training. It is not actually education. Of course, knowledge is shared, but this is more or less a different way of providing skill building, knowledge building session. Whereas in psychoeducation, the clients and their families providing information or teaching them certain skills. So the group must be client alone, family alone, client and family, and the community as well. So that's fine. Thank you very much. Now, the whole module is almost finished, but we will just share the slides and then we go one by one. That it is clear. In order to make clear our idea, we will just discuss again. Let's see. You see, psychoeducation, we discussed about psychoeducation. Psychoeducation therapy differs. Group therapy, group counseling is different from psychoeducation. Group therapy is totally a group discussion where the group and the facilitator involved. Whereas the psychoeducation is one person speaking to others. A teacher is there. Facilitator is giving information. Others are passively learning. But the similarity is both have the same God, both have a leader, and both encourages interaction. The difference is psychoeducation focuses on education, not therapy, and information, not feelings. Whereas psychoeducation based on therapy based on skill and behavior change. Now, this is we are discussing. Now, I think it is. You already said, Arker said, the Myanmar group. The types of groups we are providing psychoeducation are clients only. That means we provide psychoeducation to only clients. And then family only. Family means children, siblings, or related people. Family also could mean non-biological family members. Family and clients. That means you make the family and the clients sit together and then you provide them information on various aspects of substance use disorders and related mental health issues. And then in community settings, as said it. Now, skill-based groups. We can have skill-based group. Skill-based group, we are giving. They are what the Thai group discussed. Examples are problem solving, managing cravings, using drug, relapse prevention. All these are technically based on life skills learning. As I told you, these skills we have to teach based on certain techniques and certain methods to handle. For that, we can use role plays, any other methods to teach them the refusal skills or assertive skills, etc. So those are skills learning. It's not only providing education, but how to do it. Information-based groups, clients or families, is addressing knowledge. We don't give skills, we address knowledge. It is more than the skill-based one. It is more specific, less interaction, no discussion of personal issues. So in teaching psychoeducation, it is more or less facilitator is talking to a group of people, merely based on information, like in the schools or in the colleges. And there is no chance of personal sharing and much of interaction. What should be the group leader's qualification? This is very important. If you want to be a psychoeducator, a person who is teaching the clients must invest in providing psychoeducation. Means you must have experience in teaching the clients. You must have concern for the client. You must have experience in leading groups. You must understand the agency's treatment program. That means if you are teaching for Thai groups, you must know what are the policies of that particular Thai group. Every treatment facility has got their agency plans and programs. So you must be familiar with that when you teach them. You must also have some experience with the clients and the families. So what does it mean? To be a facilitator or a leader of a group for psychoeducation, you must have some experience in substance use disorders teaching. General task. What should a group leader? He should identify group members, adjust to the group approach, curriculum and schedule. Normally already developed in all centers, so that much difficulties, yet he must have the knowledge to teach what and what not. He must be able to handle visual aids like projector, how to use the projector, LCD projector, etc. He must also check references and materials and handouts, deliver a training, support needed after the session. That means after the educative session is over, there may be one or two clients who put the concept clearly. So you should and clarify their doubts, like a teacher in a college does. You must always update your knowledge. You must always update your knowledge means you must be able to read more latest information on addiction. Addiction is a new science. One of sciences, which is always. Now in our country, it says cannabis has a lot of medicinal values. We know that there are researches going on. So if you are a counselor, without this latest information, you cannot teach the clients, because especially the adolescents are much informed than you and I are. They have better knowledge. So we as a leader should always keep updating ourselves. We must be flexible. Sometimes they may ask questions. We should not be very rigid to answer. We should be able to be flexible in our dealing with or handling the clients. The teaching duration. The each session should not be more than 1 hour. So you have to give all the information. After the session, please remain in the room to clarify and clear their doubts. You should always welcome questions and comments from the clients. They may ask many questions. Don't get irritated. Don't get angry towards them. Try to answer the questions. If you do not know the answer, tell them that you will refer and get back to them. So you have to be very nice. You have to be a professional teacher-like. The style. You must always consider the style when you teach. You must check the age of the person. That means you should not teach the way you are teaching the elderly people. You should not teach the adolescents, because the adolescents are much informed people. They always try to criticize you, argue with you. So you must be very patient. You teach the elders, you must show a lot of respect. There may be elders who are better informed, who are much elder than you are. So all these things, the recovery stage, the interaction, the visual aid, all these things, the comprehension ability of the persons, all these must be considered while you are teaching. In simple words, you must know whom you are taking care, with whom you are discussing something, the nature of the person, the style of the person, the education of the person, the background, ability of the person to comprehend. All these things must know while teaching. So these are the that you need to consider. How do you take? How do you plan? There should be a variety of. You must use visual aids. You can have videos. Like today, I showed you some videos. So during, you can use PowerPoints, videos. You can have discussions. You teach. So that is the training you tailor. General training information. You can have periodical review of information. Use simple and common language. Break down information. If the information is so long, so lengthy, break into small pieces of information. You piecemeal. Don't give at a little. Ask the clients whether they understood. Cognitive defects. You must always keep in mind substance using some cognitive defects like loss of memory, lack of span of attention may change. Their ability to understand or comprehend things may differ. So all these things you must consider while teaching. There can also be triggers. Triggers in the sense, when you teach them and you show them paraphernalia of drug use, like a needle, bottle, or of drug using. If you some people get a craving to drink. So as leader, we must, when we show all these images, it's better not to show them any images. Because if you show them the images of drugs or drug using paraphernalias, craving, and that craving can cause a lot of issues. So be very careful while providing psychoeducation. If someone has a trigger, for example, after the class, if there is someone, because after the class he feels like drinking or he has some craving, then stay back, help him overcome the trigger. And if he is holding on, that is, you are doing for an outpatient, and if he is having a kind of trigger or craving for drinking, then help him. Maybe you ask someone to go with him to home because he wants to drink, and he might see a bar or a shop or beverages outlet, and then there is chance that he go and drink. So it is better to send someone with him if he is an outpatient, so that he goes like a recovery coach, you know. Potential topics. This is what the Thai group was discussing. What are the topics we should discuss? You see, information about specific substances, like what is cannabis abuse, all these things. We can teach about relapse prevention. We can teach about finding supports, like mutual help support and other support. We can teach them about how to avoid triggers and all other topics we discuss. Okay? That's all. Family groups. Sorry. Now, we are checking. We have been discussing about various groups. Science, family, and family, and community. So in family group, what are the things that you can teach? You can teach about family support recovery. You can also include a range of people, the family, as I said, the siblings. You can also have a non-biological family members. What is the goal of giving education to the family? The family learn, understand relapse, improve relationships. Specific. Why do we specifically family members? Because we need to give them info. We need to tell them about recovery. We need to enable the family for recovery. We also should clear the misunderstanding between family members and the clients. We must also help the family improve their self-care. What does it mean? Self-reflection and self-care. In many of the houses is abusing drugs, the family members in self-care, and if they don't take care, because of the codependency is very high, after treatment, when he goes back to the family, the codependence can also relapse. That is very important point. What is the meaning codependence relapsing? That means, like a client relapsing, if a client is using alcohol, relapsing means he is going back to codependent. Relapsing means whatever behavior pattern during his drinking, that the anger, not showing sympathy or to the client, he may start showing the same behavior when the client comes back to the house or the home. So that is a kind of relapse for the codependence. That means the codependent is not able to manage his codependent behaviors. So that is also very important. So that is why we are providing psychoeducation to the family, how to handle their codependent behaviors or codependent traits, and how to support the client in recovery. You can have all these topics like communication. You teach them how communication, if God can create issues in life, how to live in family recovery, family roles, trust, all these things you can teach the family members. Okay? If you like to share, discuss, any doubts to be clarified, we can discuss now. 10 minutes we can discuss. We are closing the session. I know you are ready to leave, ready to go, tired because the whole day we were together. I'm also a bit tired. You are also tired. That doesn't mean that we should not clarify if any doubts.
Yeah, Dr. Francis, I think one thing that we should concern, because it is during pandemic, so the group session, it should concern. All of the hospital concern about the group members and social distancing. So it is one of external factor that everyone or all of the providers should concern.
Yes. Okay. So during the pandemic, all these group discussion, other things are not very possible to have because of the social distancing and all. You are right, Dr. Parapun. But Prapun,
yes.
We must identify some methods to provide psychoeducation to the family. Probably we can use the same virtual platforms as we are using now for even group discussion or psychoeducation or anything, because we have to start doing all these things until we get freed of the corona. I call him uncle, corona uncle. He's creating a lot of problem. Yeah. So
that's very important. That's very important, Professor, because all of the trainer should tell to all of the trainee that if in case in the future have a pandemic again, so we are strength to do that. Oh, okay, we understand and we prepare the course, we prepare something like that. Very good, very good, thank you.
Yeah. So we are doing in our, I work in a medical college, we are using all the virtual platform like Zoom to teach the family, because the family members are not allowed to come to the hospital like before. Earlier, everybody, whenever they want, they can come and see the counselor. Now they cannot. One family member is allowed. So we talk to them through the phone. We talk to them through so like that we can give them psycho. Yeah, you can adopt into any method that fits into the scenario or situation. We may have to give psycho through virtual platform until we get this COVID. So use that method because we have. That is why I said a leader update his knowledge. Update his knowledge does not mean only the content. Knowledge also means using platforms, virtual platforms, how to code, how to share, how to prepare a slide. All these things are, learning new things in accordance with the changing scenario of our world. So please teach them.
Right.
Yeah, maybe you can teach them through WhatsApp, through Cisco, whatever methods you can have, or you can talk to them through phone. It may take more time, but you can teach them. Yeah, or you can send them some IEC materials so that they learn, and then you can have a phone call to discuss what they learn and clear their doubts for the family. I mean, of course, the client has to come to our center to take the treatment. Of course. Okay. Anything else? Would you like to speak?
All right. Absolutely perfect. All right.
Thank you. Thank you. My dear friends, if anybody wants to say anything, share anything, any doubts to be clarified, please do so. Otherwise, I think we will meet only on 2 to 20 seconds. Till then, I won't be with you. Yeah, right. So tomorrow and 21st, I do not have any session. I would come back to you on 22nd. Okay?
Yeah.
Yeah. If any doubts, please send it across, or you can now ask, otherwise we close. I ask everyone, so nobody is speaking. Are you sleeping? Okay. Come, dance and go home. Okay? Shall we close? Shall we close? Okay then. So thank you. Goodbye.
Thank you, sir.
Bye, Dr.
Thank you, Professor. Thank you.
Thank you.
Bye. สำหรับประเทศไทย or
Bye.
group, we may wrap up a little bit, nah? Okay, Dr. Chisu. Yeah.
Hello, Ajahn. I'm only entering afternoon, so that I'm not day.
Okay.
That's why, Ajahn.
Okay, doesn't matter. It doesn't matter. Please, I would like to hear one volunteer from Myanmar and one volunteer from Thailand. Please, like reflect all day that what are your learning today, and what are there any things that you didn't clear? Please, let's start from Myanmar side, please. Hello, Dr. Chisu. Please ask the one volunteer from Myanmar that reflect all of the session of today. That what are your learn, and are there anything that you didn't clear?
The Aga, again,
Yes, please.
because he is very active and participate, and also Dr. Tae Ao and Dr. Ong Pumi and Dr. Tien, and Dr. Yan Yu, so who will be a volunteer?
Can you hear me?
Yes, sure.
Regarding today's session, we learned what a real counseling is. I learned a concept that I've never learned before. Like a counselor never proposes a solution. Today I learned that, and also the three types of listening for a counselor, such as simple reflection, amplify reflection, and when I saw listening is a reflective listening. Three types of reflective listening: simple reflection, amplify reflection, and I think double-sided reflection. And we didn't We even did a workshop on that, the example dialogues.
Right.
Hello.
Yes.
Oh, yes.
I'm Chontida from Thai group.
Yes, please.
Okay. Let me learn today morning class basic counseling skill. Summary highlight one the trans theoretical model that individual move those six state of change to watch motivation video as some that deny this ruler is a self evolution to access where an individual is at with respect to the important confident and united to make a change on a scale of 1 to 10, 1 being not at all, to 10 being 100%. We can be applied as an evolution to key and post discussion or as a check in comparison over time. Okay, afternoon class, basic counseling skill training include module 5, group counseling learning, and module 6, psychoeducation group for client and family. Thank you.
Very good. Very good. Yes, yes. This session is very important that most of you will learn about the how counseling at the level of individual and family. So the family members are very important to besides of the client when we give the education or psychoeducation. Okay, very good. Wow. Okay. So today we are close, and I hope everyone understand, catch up, and make a